Some diagnoses come with a label that feels like the end of the road. But what if UnCurable isn't really the end? Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I am your host, Dr. Jeff Armstrong, an exercise physiologist with a passion for making science simple and life better as we age. In this episode, we are joined by Dr. Aaron Hartman, triple board certified in family medicine, integrative medicine, and anti-aging regenerative metabolic medicine. Dr. Hartman has helped thousands of patients recover from conditions often labeled as uncurable, including autoimmune disease, chronic Lyme, POTS, and mold illness. His new book, UnCurable, From Hopeless Diagnosis to Defying All Odds, chronicles both his professional experience and a deeply personal journey of caring for his daughter through a complex medical diagnosis. In our conversation, we'll explore integrative approaches, personalized care, and how hope and advocacy can change outcomes even when the system fails aging well. The Aging Well podcast encourages informed decision-making and always consult your physician and scientific literature when making decisions about your health. Well, Dr. Hartman, welcome to the Aging Well podcast. Your new book, UnCurable, focuses on your daughter's diagnosis. Can you share her story and how it shaped your approach as a physician?
Well, Jeff, I'm excited to be here and share this. It's my passion, my story, and it's changed literally thousands of people's lives. So it's really cool. It's cool that one person can impact so many people. But my wife and I adopted our daughter, Anna, from foster care back in 2007 while I was in the military. And part of my story is just that interaction with her health issues, her needs, but it was really the system, the system that she was in that actually forced me off the beaten path. So I had two major inflection points in my personal life and my career. Actually, maybe three. I guess three, because adopting her was the one that started it all, right?
Yeah, that's probably the big one.
Yeah, that was the big one. Yeah. So we had her in our home, and we had to feed her with her diagnosis of cerebral palsy. Just to put a little background to that, her birth mother did crystal meth throughout the entire pregnancy. She had a stroke before she was born. She was in a drug coma for the first 6 months of her life. So her prognosis was actually really quite grim, that she never walk, talk, or crawl. And when we brought her in our house, we had higher aspirations. My wife saw something. She's like, Aaron, it's going to be okay, whatever that means. And so when the GI doctor told us, hey, she's not growing, it's time to put a feeding tube, to cut a hole in her stomach and put a tube in there, we just knew that was the wrong thing to do. That would impact brain development. Chewing and swallowing is so important for speech. It's kind of hard to learn how to crawl when you have a plastic tube hanging out of your belly. So we said no. And the system did not like that. We were actually, Jeff reported to Child Protective Services for child neglect, because we refused to do what the specialist said. So we navigated that. My wife actually knew the nurse who investigated us. She actually worked in the system, so it was kind of one of those weird kind of things. And but for me, the major inflection point happened, besides those two, happened 6 months later when my wife found a growth chart for kids with cerebral palsy. And my daughter was in the middle. She was 50th percentile. She was normal for that. And so that was like the specialist didn't know. And we were getting ready to go down a pathway. One surgery leads to another. A typical kid with cerebral palsy will have 13 surgical procedures by the time they're Anna's age. She's 19 now. Multiple hospitalizations, multiple rounds of antibiotics, all kinds of issues. And that one procedure could have led to all those other procedures. And we said no. And so that was what changed everything. And then I started to question the system because the specialists didn't know. And so those two or three things forced me to figure out for my daughter what was going on with her. She's 19 now. She is getting ready to move out of the house actually next year. She's my first child that actually moved out of the house. We adopted all of our kids. She's had no surgical procedures in her life, one round of antibiotic since we've had her, and she's defied every expectation. And so it's been a really wild journey and ride, and it's changed my entire practice of medicine.
That's a wild story. And I've heard so many different stories of children with cerebral palsy as well as other conditions where the parents challenge the system and the kid just grows and, flourishes in life so much more than they would have had they gone down the traditional route.
Yeah, Jeff, it's such a weird thing where it's almost like the system doesn't want you to hope doesn't want you to have expectations. It's like they're almost more fearful of broken, like, oh, these are the things we could see. It's almost like they'd rather set the bar so low. And then all of a sudden it's like, oh, your child's crawling and swallowing now. That's amazing, right? It's like they set the bar so low in general for everybody. And it's a shame, but maybe it's driven by the fear of failure. Maybe it's driven by the malpractice environment. It's kind of hard to know, but it's a routine thing, especially in special needs, especially with kids with significant injuries, even adults with brain injuries. I see adults with traumatic brain injuries routinely, and it's really amazing how low the bar is set for them. Interesting story. I've got a young man I'm working with right now. This is an interesting story. He is at the University of Virginia. He had a traumatic brain injury. Been working with him for a bit. He had like mold and Lyme and all these kind of things, and was doing well until he actually had a concussion, got another one. And so for the last 6 months, he's just been struggling and asking himself, should I drop out of college? Should I drop out of college? And professors were like, you need to just drop out. Super bright kid, super bright. And then we started using a peptide, cerebral lysine, on him. That's a special order from overseas. And after 3 doses, he's like, yeah, Hartman, I spent 13 hours working yesterday and finished my project that was supposed to be due 3 weeks from now. Like, my brain's back. And it was after, we're going to do 10 or 12 rounds of cerebral lysine with him. But it's one of those things where you just can't ever give up. And that's what I want the book to be about. I want people to know, like, you can never give up. Just because someone says, there's nothing more I can do for you, doesn't mean there's nothing more that can be done.
And I think it's important for the viewers and the listeners to understand you are an MD, so you are in the system. It's not like you're some outlander, you're living out in the, remote areas of Richmond, Virginia, and challenging the system, being, just, I don't know how you'd want to label it, because you could get pretty political and trigger some people if you label it the wrong way. But I think it's important to understand that you're in the system and you're trying to change it.
I was very systematized. I was in the military, which has it's very rigorous, and that actually taught me to work around the system. If you do well in the military, part of it's learning how to work, outside the rules within the system, so to speak. Which that's probably a good way to say it. And then we're in a hospital practice, private practice for till 2022, so for like maybe 15 years, working in the hospital, admitting people in the ICU, through the emergency room, working with all the specialists in the hospital. So I was very, very in the system. Started a clinical research company. We did that for 12 years, was a principal investigator for over 70 trials. So I was very academic, very in the system, while at the same time learning all this new stuff and applying it to my daughter, then other patients, and ultimately started a brand new practice that focuses solely on that.
You brought up academics too, and I'm an academic, and I wholeheartedly agree with you that the professors that'll just give up on a student and not look at what can we do to kind of work around the system a little bit to get this person through, to help them to thrive in school. And it's kind of sad that a professor would just say, you just need to drop out, or you need to drop the class, rather than, okay, what can we do to get you through this? Yeah,
it's, our system is very good at taking really deep, specializing, taking really deep dives, but this into small things. And we're creating amazing specialists, and hand surgeons, liver surgeons, neurosurgeons, left pinky specialists. We're really good at that. But in this I've actually read a really interesting book about this by a tech entrepreneur. In this world of high tech, this world, scientific knowledge doubles every 18 months, right? Wow. In this world that's rapidly expanding, we need more uber generalists, not selective specialists. And that's kind of what I've done over these 20, 25 years, has become this uber generalist, where it's like, at this stage of my career, it's very, very, very uncommon for someone to, have you heard of this? For me to be like, no, I've never heard of that. And if I haven't, then guess what? I research it and figure it out. But in today's world, we actually need more people that have a broad range of interests, ideas, as well as curiosities, in order to survive in this really super tech-focused world.
And the tech helps, I would imagine, in medicine to be a generalist, because you don't have to remember everything that you were taught or not taught in medical school. And I think a lot of it is you're not taught in medical school everything that you probably need to know. You're kind of taught those generals. You're taught to be a specialist, and so you put in a box, and you don't realize that box is expandable, or the boundaries are actually imaginary.
Yeah, I mean, I think one of the issues is just the way our education system is set up. Like, you get your degree, whatever, MD, PhD, whatever that pinnacle of education is for you in your career field, PharmD, whatever. And it's all of a sudden like you're at the top. And it's like, really, no, you are now ready to practice. You're all now ready to actually to go into deep learning because you now have your foundation. And that's like, it's a totally different way of looking at things, but our system is kind of such that once you get to that pinnacle, for me, it's a board certification. Like, my perspective is great. I'm board certified now in 3 different specialties, but it's like, this is just your ticket to entry. Cool, insurance pays your bills now. Congratulations. It's like you are now beginning your practice for the next 20, 30, 40 years. And unfortunately, because the hierarchical way in which our system is, once you get that pinnacle, it's almost like, I've worked so hard, now I can rest. And it's like, no, you've worked so hard, now you can really work hard. But that's how people change, like, the world, how they change. That's how new things happen, innovative things happen. Yeah,
I think a truly educated person is a person who realizes how ignorant they are. Because the more you learn, the more you realize how little you do know.
Now, Jeff, you were saying you're academic. What kind of academic? Like, what field? What's your thing?
My PhD is in exercise physiology, so I teach exercise science. So I teach everything from exercise physiology to sports performance programming to exercise pathophysiology. And so I cover all bases.
And when did you get that degree?
Let's see, I finished at the University of Toledo in 1998. So
98, okay. So, okay, how much has changed in 25, 27 years in exercise physiology? Like, just what was, this is what you're supposed to do in 2002. Now it's like, yeah, don't do that anymore. It's like that field has changed so much, particularly in the biohacking world. It's changed like so much.
Yeah, and so much of it hasn't changed, and that's the problem. And the more I teach, the more I realize, I think it was about a year or so ago, I interviewed Robert Lufkin. I don't know if you're familiar with him. He wrote the book, The Lies I Taught in Medical School.
No.
And I've been thinking, I should really teach a class or write a book called The Lies I Taught in Exercise Science, because it has shifted from the time I got my master's degree in the mid-'80s. It's like so much of what we teach is wrong or not sufficient. And, we have people who, about 74% of the U.S. population doesn't even meet the minimum physical activity guidelines. And yet we're still putting these guidelines out there that aren't going to get them very far, even if they did, meet those guidelines. And so I've been teaching my students a lot more. It's like, look, I don't know enough. I mean, I'm learning every day, and you need to challenge everything I teach you, because I'm probably wrong in some of this stuff. If you're enjoying the Aging Well podcast, be sure to like, subscribe, or follow on your favorite platform so you will never miss an episode. And if you find our conversations helpful, please share the podcast with a friend, because aging is something we're all doing, and we're better at doing it together. And support our guests in this podcast financially by visiting the affiliate links in the episode description below, and use the links or codes provided for discounts on products we have vetted and feel comfortable recommending to our valued viewers and listeners. Thank you, and now back to the podcast.
I think to your point, when I was in medical school, I was taught half of what was in the textbooks was wrong. They just didn't know which half. You think about it, it takes like 3 to 5 years for a textbook even to get published, right? Then I get out and start practicing, and I learned from Dr. Ioannis at PLOS, which is the largest online medical journal in the world, that 50%, get this, of all published clinical trials, the findings are later found to be false. Okay, so half of what's in the textbooks is wrong, and half of the up-to-date literature is wrong. And that's where clinical expertise, that's where you, having done what you've done for 27 years, all of a sudden now you can fill in all those gaps. And that's the way the practice of medicine was supposed to be, evidence-based. But we've it was interesting. There's this thing called vomit syndrome, and I learned about it at a trauma surgery conference back in 2004, 2005 timeframe. And this was, this is a long time ago. This is, again, 2004 timeframe, 2005. And back then they were worried about vomit syndrome, which is victims of modern imaging techniques. And the surgery world, it's like we're becoming so dependent on an image test. People are realizing that, or forgetting that these tests aren't 100%. They have errors, there's artifacts, and you have to still be a clinician. You still have to be good at the basic art. And I was, 25, 20 years ago. So how bad is that now? And that's why your expertise, you doing what you've done for decades, that fills in the gap, the literal knowledge gaps that quote unquote science gives us data points, but the gaps are filled by your expertise, your I don't want to say lived experience, but you're doing what you do for as long as you've done it in that field.
Yeah, and I had stressed to my students the principle of individuality, which isn't even in the textbooks, which drives me insane, because it's like that is one of the most important things to consider, whether we're talking about exercise, medicine, even accounting. You're doing somebody's taxes. I mean, everybody's a little bit different. How do they fit into, what the standard is for whatever the field is that you're in? And it kind of leads me, let's get into your book a little bit, this whole concept of uncurable. We know that, patients are often told that they're uncurable. And I know you like to challenge that. We've had several guests on here that have actually challenged some conditions like rheumatoid arthritis and, all MS and some of these different conditions that people say, you got to live with it. You're going to be on medication the rest of your life. And they didn't go against it. And whether it's, you might say, well, maybe you never had it in the first place, but why are conditions like autoimmune diseases or chronic Lyme disease or POTS so difficult for conventional medicine to address?
Yeah, I love you mentioned POTS, because that's one of the things I see all the time in my clinic. It's part of just, again, it's traditional medicine, traditional specialties not knowing the limitations and thinking they are the summit of the hill. That's the one thing. The other thing is that, a lot of the things I've learned, I'm finding, Dr. Patricia Kane, who's a lipid specialist, she's been doing it for like 30 or 40 years. Dr. Larry Afrin, who's like one of the top mast cell guys in the world, he's been doing that for, decades. And in order to things to get to the mainstream academics, it's usually 20 or 30 years downstream. So all of a sudden, you have to not just know what you're taught, but also be willing to look at other things in other countries and places in the world. And our system, because of the way it's geared with reimbursement, the way insurance works, the way board certification works, I mean, I could literally lose my license for treating a chronic Lyme patient with antibiotics for 3 months. That's kind of ridiculous, especially when a kid with acne can get them for years, right? And so
Right.
There's all these disincentives for people to think outside the box that are more than just academic. They're actually, you might lose your license, your career, your status. And so all those things play into, okay, now you have rheumatoid arthritis. What does my board say is okay? What are my journals that, again, are dated and half wrong? What are they telling me to do? What does my recent test I studied for? What did it say? And so what that means in my world is 10 or 20 years go by and the treatment of hypertension doesn't change that much. The treatment of heart failure, diabetes, doesn't change that much. But what you have to do is look outside the box, and we look at systems biology or translational medicine, which are different ways of looking at the same information. Systems biology is how's your heart relate with your gut, relate with your brain, relate with your environment. Your environment affects your health, relate with the food you eat, chemicals in the environment, et cetera. And then systems biology is actually is like basic organic chemistry, which I was told in medical school I could forget about, and applying it to the person, individualizing absolutely, positively everything to the person in front of you. And so I've had patients with rheumatoid arthritis go into remission. I don't like to use the word cure, because whatever you did to get there, you have to keep on doing. Routinely people will be like, well, when can I go back to my usual lifestyle, my usual diet, blah, blah, blah. I'm like, well, do you want to go back to being sick again? And people just don't realize whatever it took to you're training for an athlete, you're training for a marathon, you're training for some event. Okay, I got it, I won. It's like, if you want to stay at that level, guess what you have to keep on doing? You have to keep on training, and people don't realize their health is the exact same thing. And so I've had patients with multiple sclerosis go into remission, inflammatory bowel disease go into remission. And part of my daughter's story, because she's a very, very extreme example, like had a stroke before she was born. You may know what this is. When she was born on an MRI, she had agenesis of the corpus callosum, which is the connection thing between her left and right part of her brain. It wasn't myelinated. It was just like this hole in the MRI. And so she was pretty bad off. And so for her, it's like, I've always had to keep on finding a new thing every year to add on as she progressed, which is not typical. But I think for people, you have to realize there's so much out there. When someone says, there's nothing more we can do for you, that really just means I can't do anything else for you. And that's when the person, Jeff, needs to say, okay, it's time for me to go somewhere else and figure something else out. A little interesting thing, actually, there's a book. Where's my book? I just finished reading. It's right there. It's called Cancer Care by Dr. Merrick. At one point in time, he was the most published critical care specialists in the country. And this is a book that has 1,500 citations in it. So the citations are 50 pages. So this is the way he rolls, right? And in it, he talks about breast cancer and looking at repurposed medications and other integrative things. And according to published literature, getting your vitamin D level for a female with history of breast cancer can be as effective as a aromatase inhibitor, which is a hormone blocker for preventing recurrence and metastasis of breast cancer. Like, I talk to patients about they're like, my oncologist never mentioned this to me. Like, you mean that getting my D level to 80 or 100 can be as impactful as like this crazy drug that's going to give me osteoporosis and make me tired and give me brain fog and all those other things? I'm like, yeah. And so that's where you have to keep on pushing the limits. And if you get to the limits with someone you're working with, they're like, this is just as far as they can go. And part of my joy of this is I love learning. And so I did this for the first 15 years of this thing, but I'd see someone with something I'd never seen before. POTS, what's that? Autoimmune autonomic ganglionopathy, what's that? And I would just learn about these things and kind of master the issues and then apply that to other stuff. And that's where people have to realize there are other options, things out there. You can never give up on yourself, on your loved one. You can never give up hope, because the minute you give up hope and you stop fighting, that's when, this is as good as it gets. And I've seen too many people to defy all odds. And I have other stories in my book as well of other patients who've broken the mold, to accept mediocrity in any patient, any person I see in my clinic.
Even in a lack of disease per se, what we would consider normal. And this show is the Aging Well podcast. We really like to emphasize the, because we want to be looking at how do we get people to age well. And we believe aging well begins, we say at birth, but, I believe it's before birth. I mean, like with your daughter's situation, her capacity to age well was affected before she was born. Sometimes it can even be, if you start looking into epigenetics, even before conception. But, we're looking at trying to get people making the changes that are going to allow them to live better lives. And all of that starts early.
All the foundations of all these really cool, fancy things that I've mentioned in the book and I've talked about before are foundational. Real food, gut health. You have to eat real, unprocessed food. And it gets a little complicated when you start thinking about what real food is. And we actually have this resource. We have a bunch of free resources in the book. And one is a nationwide food sourcing guide where you can get real food anywhere in the country. But all of a sudden, the building blocks are huge. 80% of heart disease and 70% of most cancers can be prevented by diet and lifestyle alone. So all of a sudden, those basic things, are you eating real food in moderation? Exercise, sitting is the new smoking, right? Literally, right. Sitting is so bad for your health. It's like almost as bad as smoking for you, right? Physical activity, a sense of meaning and value. There's an interesting book. It was Man's Search for Meaning, I believe is the name of the book. It was about, it was a psychiatrist and Frankl, Viktor Frankl.
Yeah, Viktor Frankl. That's a great book.
Yeah. But the point is, like, if you had a reason for living in a concentration camp, that was the difference between life and death. Like, there are people that had an easier life. They're the better, well taken care of prisoners, and they died like flies. And the people who were harder treated, mistreated more, but had a reason for living, survived. And that was part of Frankl's story of his survival. But it's like having meaning and value, people who love you, people who you love, clean food, clean air, clean environment, meaning and value in your life. Like, these things are like foundational. They should be. Everybody should have this stuff. And on top of that, all the cool stuff happens that we've done with my daughter and other patients as well. But the basics, perfect the basics, just like a professional athlete would. And then everything else tends to just fall in place. And if it doesn't, through advanced testing, then if you want to age well, do all that stuff first. Then you do testing and you find out where's your gaps. Because you will have, regardless of what you do, Jeff, you'll have gaps with nutrients, gut health, toxins you had no idea you're exposed to. You might not know the silver filling in your mouth or the root canal that didn't take is making you inflamed. You might not know that food poisoning you got 25 years ago, you got a little parasite in your gut no one checked for, and that's the reason why now your joints ache. So all that cool stuff is built on top of foundational stuff.
So you do a lot of integrative and regenerative medicine. How do these approaches complement standard treatments for complex illnesses? Because I think a lot of people think it's one or the other? It's like traditional medicine or these radical approaches.
I just call it good medicine.
That
The
sounds
practice of medicine is just supposed to be ever increasing. Like this is what the way they thought in the late 1800s and early 1900s before all this technology. And it's almost like we got all this technology and forgot how to think. And so the idea is that you take all this stuff and you apply it to you, Jeff, and okay, you do the basics. Great. Now let's say you have your joints aren't healing and you're not healing quite as well because you're 62. Sure, let's try some BPC 157. That will work great for gut issues and joint problems. You probably have a poor issue absorbing protein. Let's check on organic acid. Yeah, your whole body amino acid levels are low. You need more protein. I can see which ones you're deficient in. Usually branched chain amino acids and collagen-based proteins. Strangely enough, put those in. Typically, people have their lipids, their lipid membranes are off. Fix that. And all of a sudden, you put this together, and then, oh yeah, you broke your leg. Okay, yes, see the orthopedic surgeon, get that fixed. You have appendicitis. Get that taken out. Like, it all goes together. It's not an either or. It's a both and that's why, like, I'm excited to keep on practicing because my toolbox just gets bigger, literally month from month. I'm adding new little tool here, a little tool there, and over 20 some years, it's just I got a pretty big toolbox. And there are patients, Jeff, that I've worked with that I've kind of gotten stuck with that were kind of like hanging out. Okay, we've peaked out, but you're only 80% there. And those people drive me just like my daughter did to keep on thinking. And what typically happens is I will learn something within a couple of weeks of either seeing one of those people before or after that I then apply to them. And that's one of the things that excites me. But our system, current healthcare system, through the reimbursement, through everything I mentioned before, stymies and stifles that kind of out-of-the-box thinking and curiosity and practice of medicine.
So you've talked a bit about your daughter's story. I don't want to give all the stories from the book. I want people to go out and buy the book. But can you share any specific strategies or interventions that have produced really meaningful results for patients that were previously labeled as uncurable?
One thing I really, oh my gosh, there's so many. Which one do I pick? I'm one of the many. I'm certified in many things, and one of the things I'm certified is in hyperbaric medicine. And it's an interesting tool that has been around since the 1600s, which is crazy to think about. It's not new. It's an FDA-approved modality. We have tons of literature on it, but insurance doesn't really pay for it for all the uses like traumatic brain injury. If you're getting surgery for a knee replacement, hip replacement, or had a wound, it actually speeds your body's healing up. It increases your stem cells in low pressure, 1.3 atmosphere environment, not 1.5 or 2.0. Increases your stem cell activity 800%. There was an interesting study. I don't know if I mentioned this in the book or not. Who knows? Who knows? I've been talking so much these days, But where they took pigs in the 50s or 60s, I learned this in my certification. They put them at 3 atmospheres in a tube compression device. Took their blood out and replaced it with normal saline, and the pigs just did their pig thing, hung around, oinked, defecated, peed, and ate. They did that for a couple hours. They put the blood back in, brought them back to 1 atmosphere pressure, and they were 100% fine. And the point of that study was, which we wouldn't be able to do today, right, is that you can overcome having no blood in your body just with oxygen and pressure, which means if you're old and you have stroke, you can bypass the blockages. If you have heart issues, cardiomyopathy, you can bypass the blockages or get new stem cells to grow. Hyperbaric is such a powerful tool, and we have literally dozens of things just like that are being left unused for people who could benefit from them.
Yeah, we've had a couple guests with hyperbaric, and I feel like I missed the boat on hyperbaric because my dissertation was on hyperoxic training. And so we've had several guests on here that have either, the more hyperoxic type of treatment and training. And then we had Will Peoples, who Will was he was on the U.S. Olympic bobsled team for, I believe, 7 or 9 years. Numerous concussions. His brain is just beat to hell because of all the concussions that the USOC just ignores, denies, whatever you want to look at it. And he has found, the best treatment for him has been in hyperbaric training, or the hyperbaric chambers. And so he's on kind of a quest to try and get that type of treatment available to, our military who have had traumatic brain injuries, athletes, and so many people that can really benefit from that.
And you can also, I have some patients that are, professional football players and other kind of high-level athletes, race car drivers, et cetera. And you can use it as a preventative as well. For example, if you're a front lineman playing football, they've done MRIs of people who, and some of them actually have their own chambers they take with them when they travel to games. And they do it routine, like 5 days a week, right? And you're doing it as a preventative and then as a treatment. And they've done MRIs on people's brains in professional football players, and you can see just literally the average person can see a difference in the brains from those. You can literally go, which person you think is using the MRI, the hyperbaric, and they can tell. And so you can use that as a preventative. You can use it as a treatment. There's an interesting research going on in Israel with using hyperbaric for race car drivers. Because when you're driving, 200 miles an hour, like literally a tenth of a second is the difference between crashing and being number one. And so all of a sudden that memory, that higher executive function, and you can actually improve that with being in a chamber and then basically doing eye saccades, eye movements, like guided imagery of the race, because it basically increases blood flow to those parts of your brain. So you can use it as a performance enhancer as well. So it has so many utilities. There are some things you got to be careful with. You can get oxygen toxicity, which if you do it right, it's kind of hard to do. But you know how people are. People, if a little's good, more is better, which is not the case with many of these things. But it's one of those things that, it's in the average physician, average practitioner. How many people get in car accidents? How many people ride a roller coaster and they're dizzy for 3 days afterwards? I had one patient that was in Home Depot. She sat up, hit the back of her head in the open door, and she was dizzy and had memory issues for 6 months. Like the average practice is not going to recognize these small micro concussions or small, whatever you want to call them, and treat those. And this is what worries me, is there's a kind of dementia which is related to traumatic brain injury. You may be familiar with the movie, I think it was Concussion. Was Will Smith in there, and it basically was talking about chronic traumatic encephalopathy, CTI. That is, you get injured, and the inflammatory process does not stop. Muhammad Ali, you could tell at the end of his career was having issues, but his diagnosis, I think, was 3 years after his Parkinson's diagnosis, after he retired. You can actually stop that degeneration with hyperbaric. And so there's so many uses for it in so many different places. It's just people need to know about it and then apply it.
Yeah, that movie Concussion really hit home for me because I'm from Pittsburgh, and it kind of opens with Mike Webster's, suicide, and just, to me he was like still probably one of the greatest centers ever to play the game, and to end his life the way he did, homeless, living in his truck, unemployable, and end up killing himself over, something that was treatable, and we just didn't know.
Well, some of the Israeli research is interesting because you can have a trauma. Part of what your brain does is actually you'll lose these memories of whatever happened to you, and the brain flow to certain parts of your memory part of your brain will actually decrease. And what they found is actually putting these individuals in a hyperbaric chamber, they actually will start to remember these lost memories, and then they have to see a counselor to work through the memories they're having back now. So it's a really cool. It's one thing of the dozens that can be used in so many. You had your cancer patient, you've had radiation and chemo. You can actually use it to minimize post-radiation necrosis and scarring in tissue. If you're getting any general surgery, you can minimize inflammation. You can heal quicker, rotator cuff, knee, or chronic Lyme disease. Kids with autism, PANS. It has so many uses and data behind it, but there's like 12 or 15 FDA-approved indications for it, and outside of those, insurance won't pay for it.
Yeah, we got to get past that. We got to change the medical system so that these approaches, which in the long run are cheaper than allowing the condition to proceed.
Yeah. I've got one patient with Crohn's. He's been off of his biologic, his Remicade, for 7 years now. He's had no hospitalizations. And that drug alone has saved his insurance company, I don't know, being off of that for 5 years, a couple $100,000. And everything he does is out of his own pocket.
Wow. So, in those situations, we have, families are equally involved as the patient is when it comes to some of these chronic conditions. So what advice would you give to the families that are caring for those loved ones to navigate these complex medical journeys?
You have to, ultimately, you have to meet every person where they're at. And the reality is a lot of people can't have hope for themselves. They kind of get in these spirals. This is as good as it gets. There's nothing else that can be done for me. And what the family members have to do is find out where their loved one's at and just meet them where they're at and just not give up on them. Have hope. And sometimes all you can, part of being empathic is suffering with someone. I'm sorry, that's the sympathy. So I'm getting sympathy, suffering with someone. And so sometimes the family member has to just be in their presence and just suffer with them, research, be prepared, and then just be there so that when they're ready to make changes, they can. And that's the hard part, because I'm a doer. I'm a go get done kind of guy. And many of my patients, it's just I have to be present with them until they're ready to move on with stuff. And so not giving up and being educated. I think education is a big thing, because with all the marketing and social media and Facebook and all the stuff out there that just focuses on shiny objects, newest trends, or controversies, and doesn't focus on actually deep, meaningful stuff. You have to find those sources of education information, which is one of the reasons why I've done over 400 blogs on my website. We have this stage, I think we have over 1,000 videos and stuff on the YouTube channel. On my podcast, we're getting ready to hit our 100th episode. I put so much education stuff out there because I want people to have resources. I've even done, I've had probably over 500 or 600 books recommended to me. I've vetted and read about 200 of those. And I have a reading list on my website of books in this field. Anything from learning about healthcare, The Immortal Life of Henry Lax is a really cool book that helps you learn about our healthcare system. Blind Spots by Marty McCary is one of the books on there. The Disease Delusion by Richard Bland. It's a really interesting book about, our system. He's the grandfather of functional medicine. I have all these great resources there. So I think people just need to find information that's from a vetted, from a source they know, like, and trust, and then just get educated, because that's a big part of it. When everything outside says this is as good as it gets, COVID, what happened with the pandemic is a great example. People believe that we're going to die. And don't want to go into that because that's controversial and might get us canceled. But the point is that, we believed a lot of things that just weren't true.
And I hope that's what we're accomplishing on this podcast a bit too, is giving people some of that hope, giving them some of the tools to be able to fill the gaps between what's real and what's, just inflated out there. And so you have a lot of hope, and it's obvious in your practice. How do you go about balancing that hope with realism when people are facing severe or life-altering diseases?
What do you mean by realism?
Well, I guess that's a tough question, because, realism, we're almost talking about not having realism, because realism can be, it's hopeless, but we're going to have hope. So I guess maybe, what is realism to you as you look at, people with these severe conditions that others are saying are uncurable?
So let's talk about cancer.
Okay.
Because that's about as bad as it gets, right? You got this diagnosis. And I'll give you a story and talk about a book that people can read on my reading list, right? Of course, right? I had two patients several years ago. One was, they're both in their 70s. One was we diagnosed with malignant mesothelioma. And that is usually a slow-growing cancer. It's pretty horrible to treat, and you die from it. It's horrible, but it's usually 3 to 5 years out. You're not dying in a month or two. I talked with this guy. His wife came in. We made the diagnosis. He was having some neck and back pain. The CT picked up the mesothelioma. In the room, his wife was crushed. She was bawling, her husband. She knew her husband was going to die. Now, you've got a couple of years. She was crushed, and in his face, you could see that he was done. Seeing his wife suffer, it was almost like his eyes were blank. His eyes looked like the eyes of my grandmother the day after my grandfather's funeral, to be honest with you. And he died a month later. He should have lived for 2 or 3 years. Different patient, same time frame. We diagnosed him with a renal cell cancer. Now, renal cell cancer, usually you're dead in a month, metastasis. His was huge. It's quicker cancer. Dr. Hartman, he was actually 83. Dr. Hartman, I've lived a good life. I know where I'm going when I die. I've got great grandkids. I'm happy. He lived for 4 more years. And so a diagnosis that you should live 3 or 4 years, died in a month. A guy who should have died in 3 to 6 months, died 3 to 4 years later. And it's amazing how much your mindset affects your physiology. there's an interesting book called Radical Remission that talks about spontaneous remission, which is where cancers disappear spontaneously. And there's over 1,000 cases of these recorded in the medical literature. And the researcher who actually wrote the book was actually a PhD. She was working on a PhD. She was a psychologist that worked with the counselor. When you get diagnosed of cancer, you get depressed, right? She was actually the counselor, worked with them. And she had a patient one day came in with melanoma, and it was gone. And she's like, huh? What? Went to the oncologist. Oh, yeah, that happens sometimes. It's called spontaneous remission. And she was like, what? Like, no inquisitiveness. So she made her PhD research project, finding a bunch of these people, interviewing them, and she found 9 things that when the people who have spontaneous remission, which is not common, but not uncommon, had 9 things in common. And one of them was their mindset, was their attitude. And so, I hear what you say about realism, but your body can do amazing things if you put the right stuff into it and have the right attitude and the right focus and hope. And it doesn't mean you have unrealistic expectations that, whatever, but people underestimate the power. There's a whole field of medicine called psychoneuroimmunoendocrinology. It's how your brain affects everything else. And you can get a PhD in this. We underestimate how our perspective, how we look at the world, our attitude, how that affects our health. And we see it routinely in my kind of medicine. We'll get people 80% better, 70% better. And it's trauma. It's a past issue, and their nervous system is on edge. Their brain's not allowing their body to heal because of trauma, stress, whatever's gone on. And I think hope is a huge part of, no one can say what your end is going to be. No one can say my dog. I've had so many patients get stuck and get better. And so I'm not going to put my limiting beliefs on a person. If they choose to have certain limiting beliefs, like this is as good as it gets, well, okay, but it's hard. And there's always a ceiling to it. I had one patient come to me with a diagnosis of autoimmune autonomic ganglionopathy. There's like 50 cases a year in the United States, and her whole GI tract shut down. And she came to me from Mayo, had a feeding alignment because she couldn't eat. And I had to pull it out because she was actually relacting her she was getting vessel inflammation infections from the Lyme. I pulled it out, and it's like, oh, you can't eat. I just pulled out your fluids. Like, you might die. And we're 5 years later. She's 7 years later. She still had health issues. She has ups and downs, but her health trajectory has been up ever since that moment. She never gave up on herself. Her mom never gave up on her. Her family never gave up on her. So I hear what you're saying about realism, but I think we set our own peaks. We set our own limits. And if you talk to elite athletes. Talk to Uber athletes, talk to Elon Musk type people. Like, they want to go to Mars. they want to habitate other planets. I'm like, that's crazy. But in the meantime, they also do really cool things.
So realism is something we really need to kind of get out of our mindset, is what I'm hearing, is that we want realism to be that our capacity is far greater than we imagine.
That's, realism to me is a form of art that I learned about in art history, right? Your capacity to heal, your capacity to do in this life and whatever is greater than you can imagine. There's so many examples of that in history. That's the reason I love history. I love reading about people who've done amazing things, because they teach us that amazing things are possible for ourselves. The question, and the only difference between crazy success and failure is you quit a little early. Look at successful businesses, entrepreneurs. We have so many examples today of people who've done incredible things. And the only difference between them and the other people is that they just didn't quit and other people quit maybe a week, maybe a month before that business was successful. They found the cure or whatever, And so, my father-in-law, he had I talk about him in the book. He had a liver transplant back in the 80s. He had a liver transplant in the time when the average life expectancy was a couple of years, maybe. Everybody in his transplant class has been dead for decades. He's actually now outlived the specialist, the GI doctor and surgeon he worked with initially. He's like 43, 44 years into his new liver. He's beaten every solitary odd. So these people are out there. It happens. It's just, can we educate, encourage, empower people to believe better for themselves? And this message, some people will be offended at it and upset about it because it's challenging. It's basically putting some responsibility on them. But that's the reason having a team around you of family, friends, people who are on your side is super important, because sometimes you just can't, the reality is a lot of people can't do it on their own. They need just like an elite athlete has all these people behind them, or a race car. You need a group of people behind you that will support you to help you in your journey. So,
yeah, we started this podcast with really 4 pillars to aging well, which I had evolved for me from teaching pathophysiology and exercise. And that was, exercise, eat a healthy diet, maintain a healthy body composition, and don't smoke. You do those 4 things, you're going to, have a better chance at living longer. And over the course of 4 seasons of this podcast, I've grown that to, sleep being of importance, but probably and as an exercise physiologist, it's hard for me to say that there are things more important than exercise and diet for your health. And I think the most important thing really comes down to purposeful, and I emphasize the purposeful part, because a lot, you say social connections, everybody has friends. They might be good friends, bad friends. Like you said, you can have friends that'll be supportive of you in your disease. It's like, oh, I feel bad for you. We're here to help. But it's all giving that comfort in that resignation that, we understand you're going to die, rather than those friends that are like, okay, what can we do to get you through this so that you get out of this condition and you move forward? Yeah. Having those purposeful social connections, and doctors who are purposeful in terms of their relationship with you, more so than being transactional, being more transformational, are going to be the things that really get people living longer and living well.
I mean, there are 5 foundations to functional medicine: diet, exercise, sleep, meaning and value. And so, like, those are the foundations. And so the basics. And having a purpose and meaning in this life is huge. You cannot underestimate that. I think about the Lord of the Rings, Frodo and his journey to the ring of Mount Mordor. And even Smeagol, even the bad people, even the White Wizard, right, without them, he wouldn't have got there. And at the end, it literally took Smeagol, I forget his other name, another name, but it took him popping up for actually Frodo in the end to actually get to his quest. And life is like that. You need in order to do great things, you almost have to have an adversary, a insurmountable obstacle to go over. And with your health, it's the same. And so you need people you need your Samwise, your people that are just, I'm going to be there no matter what. I'm going to put you on my back. I'll pick you up, And sometimes you need your Legolas, your really cool guys that can shoot, arrows and whatnot. And so you need a team around you. And people who've done really cool things, who've surmounted all odds, patients, athletes, whatever, I've yet to see that happen without some kind of team around them, without meaning and purpose, without a why. Like, what's your why? Why do you want to get better? Why do you want to do that thing? Why do you want to be an elite athlete or be super? Like, why? Really, what is your why? If it's just more money, more fame, that's a very superficial, insignificant why.
Another question I really push my students to ask too is find your why not as well, because, it's important to understand our why, and sometimes that's easy, but then our why nots is, well, the doctor says there's nothing they can do to treat this. I want to live, but there's nothing they can do to treat me. And why not? What can we change in the system to get you through this? And I love that that's what you're really working to do in the healthcare system.
The thing with AI tools now, there's so many cool tools that I use that I encourage patients to use, that you could literally go out there, take your history stuff, plug it in there, and just say, I want you to look at this outside the box, and just prompt it. And it's amazing sometimes now it's not always correct. AI does hallucinate. In my world, we say AI will AI, but it can help you think outside the box a little bit when you don't know where to go and what to do. It gives the world of information to your fingertips. You have to know its limitations, but with information being so free and so liberal these days, everybody has the tools. They just need to find a source they know, like, and trust, find reliable stuff, and then be engaged in their own personal healthcare.
And I think education's role now is less about giving us information, but more about giving us the critical thinking skills so we can sort through that information as it's presented to us and know, well, that makes sense, that doesn't make sense, this is worth trying, this is not worth trying.
Yeah.
So looking ahead, what do you see as the future of integrative and regenerative medicine for patients with chronic and complex conditions?
I mean, it's hard to know because every year or two, some crazy things are coming up. I see I see this as the future. This is the future. This is what people want. People want an individualized. And you say, what would you want? Would you want an individualized program for you that looks at your personality, your history, your environment, your house, your medical issues, and gives you a personalized plan based on the most up-to-date science and data around the entire world? And actually, historically, they'll go back to the past and look at what's going on right now and pull it all together and apply it to you. Who says no to that, right? I mean, this is what educated, empowered people want for themselves. And people, the business. The problem is it's becoming a big business. Supplements are, I don't know, $20, $30 billion business, all these gadgets. It's become a big business. And unfortunately, that means you'll get bad players in there. So I feel like as the opportunities arise, we'll also have, shiny objects. A great example, Consumer Reports put out a thing 3 or 4 weeks ago showing that 30% of all protein supplements you buy online have excessive amounts of lead in them. And pea protein was the worst offender. So all of a sudden, I told you need protein, you need collagen, You go out there, buy your cheapest thing you can find, and a year from now, your feet are numb and you're foggy and you have anemia and you've given yourself lead poisoning. It's like, so I see the future is bright. It's wide open for an informed, cautious, but excited individual. And so I don't see a limit to what's going on, but I do caution people that, it is kind of the Wild West right now. I kind of like the fact that it's not managed by the government because it speeds up innovation, but also puts on the consumer. You have to vet your supplements, what you're doing. A lot of these things they say, oh, I did this new safe, cool thing. It's like, it's not, all these things aren't 100% safe. So I'm super optimistic, but first and foremost, the Hippocratic Oath is do no harm. And so whatever I do with the patient has to be at least as safe as the standard of medicine, which because of all the iatrogenesis and some of the research showing maybe medical error is the third most common cause of disease, death in our country. It's not hard to reach that standard. But the point is, I'm super optimistic, but also cautious at the same time because we're getting more and more dishonest players or people who mean well and just don't know what they don't know. There's probably more of those, to be honest with you, people that mean well and don't know what they don't know that are pushing different fads. And so I think part of the challenge will be for people to know which voice to listen to because there's so many. And it's driven by influencers, which are usually not an expert in the field.
Yeah, and that is, I think, a really, really big challenge for us. And even on this podcast, it's like, how do people know that what I present on this podcast is good stuff? And I hope the reason people trust in the podcast is because we're not out there to just promote ourselves or promote others. We're out there to get the information out there, but underscoring that don't believe everything you hear on this podcast. Do your research, understand, what is good and what is bad. And if you are buying a supplement, understand that just because a certain supplement has been demonstrated to be effective doesn't mean that everybody selling those so-called effective supplements are selling you a good product. And so you have to know the product as well. And it's challenging, but I think there's a hope for that.
Yeah. One thing actually we're going to be launching soon on our website is a Dr. Hartman AI. And it's literally all my blogs, all the videos I've done for the last 7 years, which is everything I've talked about, put in one database and then AI-ified so people can come ask questions. And they're literally getting them answered by me, but from things I've done in the past. And it's cool because it'll actually give you references. You can click on and go to which video, which article I talk about. So I'm really excited to put that out there because I think it'll be an opportunity for people to actually ask me questions, my AI me. And we've been using it within our team for online patient questions for the last 4 to 6 months, and it's been working pretty well. So I think we're ready to launch it to out to the general population. But just finding good stuff, and what I tell people all the time as well is that after 3 board certifications, I'm assistant clinical professor of medicine. Like I could go on, 70 clinical trials, blah blah blah. Like I don't know what I'm doing. I'm still learning, and so I'm really super like. And that's where I struggle because I don't consider myself an expert in anything because I have to know like everything. And it's a big, big challenge. It's a big weight. But and so I tell people is the people who really know the more you know, the more you realize you don't know. And so the people that are like out there confident, like, Dad, I'm the expert, and I'm always like, really? Like, because I feel like I've done a lot. I'm still learning, So, yeah, again, you have to find people you know, like, and trust, and then, maybe cross-check them with AI. But AI it is gated, and it doesn't get you all the right answers all the time. So it's you have to know enough to know when it's kind of hallucinating. So,
yeah, I do not like the word expert, and I am very hesitant when somebody presents themselves as an expert, because it's like, really, you're an expert? Okay, you might know more than everybody, but what is truly an expert? I mean, it's, to me, what an expert is that person who realizes how little they know in their field. There's a saying in academics where, when you get your BS, it's bullshit. When you get your MS, it's more shit. When you get your PhD, it's piled higher and deeper. I don't know if there's a phrase for, medicine, but, it's, and there's also that phrase, if you learn more and more about less and less until you know everything about absolutely nothing.
Those are wise statements that you should take at heart. In the book, actually, I had talk about my mom. I always tell my mom when I was younger, I was an expert. Moms can put you in your place sometime.
Oh, yeah.
And my mom, she's just hilarious, but she was like, you know what an expert is, Aaron? I'm like, okay, what, Mom? Because I just told her I was an expert, right? She's like, an X is a has-been, and a spurt is a little squirt of water. What do you say to that? It's your mom. You're like, it's like, you know what, Mom? Thanks. Yeah, I'm an expert. I'm a has-been spurt of water, But your point, it's like, I think those who really know, those who are really wise, who've really studied and seen a lot, had over 100,000 patient encounters in 7 countries and 4 continents. Like, you realize that there's so much more that you don't know. But that also, for me, when I see a patient with something I've never seen before, that's the reason I have hope. Because I'm like, you know what? There's more out there that I've forgotten more in my life than I'm going to learn in the rest of my life, realistically speaking. And so that for me is always like, well, that's a challenge. Like, what data point, what thing have I not learned that I can apply to this patient? And so that thing, going back to your question about hope, realizing how much there is out there for one person to say, this is as good as it gets, it seems like a little bit of hubris to me, to be honest with you.
So now it's time for me to kind of ask the question we ask of all of our guests. What are you doing personally to age well?
What am I doing personally to age well? I eat real food. We live on our own farm here and have a freezer full of our own cow we raised. Eat real food, try to get plenty of sleep, and try to make a difference in the world. Trying to have a life of meaning and value. Trying to make a difference in the world and raise, part of that is raising caring, meaningful children that will go out in the world and make a positive difference. And that's kind of, and of course I exercise as well. I'll put that on top there somewhere. But
yeah, we keep pushing the exercise down a little bit. I mean, obviously everybody, that's the first response from a lot of people. It's like, I'm exercising, I'm eating right and doing all those kind of things. But I think, what helps most people age well or age the best is having that purpose-filled life. And it sounds like that's where you're at in your career.
My father-in-law, when he got his liver transplant, his first thing was like, I'm going to die, like in a year or 2 or 3. I've got a couple more years. Like, I need to make it to see my girls graduate from high school. I got to get them through high school. And then I was like, oh crap, college. Oh my gosh, I got to work harder, get them through college. They meet some boys. It's like, I would love to walk my daughters down the aisle. This is so cool. Walks them down the aisle. Grandkids, and then they kind of grow up and they're like, and him and his wife are like, we're going to travel the world. And it's like having that thing. Maybe that's part of the reason why he's like, it's really funny because he read the book and he gave me a review online, blah, 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 kind of jazz. But he's like, when you say thriving, Aaron, like, I'm thriving right now. I'm 76, 77, had a couple surgery, other stuff with my liver transplant. I'm thriving right now. I'm living my life I want to live. I'm like, that's pretty cool. That's really cool.
Yeah, that's, I think, the most important thing in life. So is there anything we missed talking about today? I feel like we covered a lot of stuff.
We hit a lot of different things, my friend. We hit so much stuff. I don't know. Buy the book. Never give up. Get your team around you. And if you're a healthy person who wants to be healthier, what are you living for? What's your purpose? What's your, it's really, people focus on fancy scientific stuff, that supercharges whatever you're doing, but the basics are still the basics and the foundation is still the foundation.
So where can our viewers and listeners, you mentioned your website. What's the website? Where can they find the book? Where can they connect with you to learn more about what you do?
I've got so much stuff in the ether out there, but two major sites. One is AaronHartmanMD.com. That's like the plugin that kind of takes you to like my business website, my practice website, my podcast, all that stuff you can find from there. And then the book is UnCurableBook.com. You can spell it UnCurable UN, which is how it's spelled, or IN, which is the correct spelling, but I thought it was cooler anyway. And that'll be the book, and you buy it, click on it. It'll take you right to Amazon. You get off Amazon. And the Audible, I'm not sure when this is coming out, but the Audible version will be out probably in 2 or 3 weeks. So there's that version as well.
Do you do the Audible? Is it your voice?
It's not. No, they wanted me to fly out to LA to do it, and it'd be a day out there, a day there, and a day back. And I don't think I sound, personally, I don't like my voice. So I didn't want to do it. So I had a professional, somebody who sounds better than me read it. So
yeah. So with your AI, is it going to be where they click on a button, they ask the question, and an AI image of you and your AI voice pops up and gives them the answer? Well,
you can actually type it in, it'll give you an answer back, or you can make a phone call, and then like an audio version of me will like answer it on the phone call. So it's kind of a cool, that's how it works internally. And so that's, I assume what's going to look like when it's out there. But I think for me, again, I'm the doctor, scientific guy. I think the cool thing is it's like, where these answers come from. It'll take you to the videos, the blogs, the things I put out there. And if you're not sure who I am, who's this guy? I mean, if you go to my website, I've got my CV there with all my research stuff, and you can see like, I'm kind of legit. So, but that's the thing I think is really cool is like, the little reference thing to it. But it'll be 2 options on the AI tool, so which I'm excited about. We actually had a meeting this past week and like put it out there, watch it. This is so cool.
Yeah, I think that's interesting. And I think that's a fascinating aspect of AI is that, you can generate such realistic images and, reflect the voice of the actual person. And it's such a cool thing, but it's also such a dangerous thing in our
If you know the person, because I'm in a group of people who use this kind of stuff routinely, that's not them. It's not quite there yet, but it's like way better than it was, 6 months or a year ago. It's going to get to the point where you can't tell, and that's the scary thing. Then how are you going to know what's real and not real, what's generated and not generated? So that's where it does get a little scary. So you have to meet the people behind the AI, right? That might be the next thing. It's really funny with the AI world. It's almost making us get more personal. Like you have to know the sources, because otherwise you have no idea where stuff is coming from, So maybe this will make us, maybe AI is going to make us more human.
Let's hope so.
Not less human, because it's going to force us to like, you can't trust anything. Like, where is it coming from? Like I said, this is my stuff. I trust him. Okay, cool. It's going to make us more relational and less, computerized, whatever you want to call it. So that's my hope.
Yeah, I mean, I think most people are smart enough to know that if they call into your a video pops up or an audio pops up on your website giving an answer, that it's not actually you, that you're not sitting at a computer waiting for people to type a question and you're going to suddenly answer.
It's not just waiting for me to at 3 a.m. I thought you said,
So this has been an awesome conversation. I think I have to have you back on because I think we could dive into some deeper things. So let's plan on doing that maybe in the future. Again, maybe when the next book comes out.
Actually, the next book I'm writing with my wife, because she is my, she's the wind beneath my wings. Like I say it joking and 100% serious as well. I wouldn't be where I'm at without her. But she's the main impetus to my next book, which is the optimization myth. So, which actually might resonate with your audience and talks about a lot of things that, the optimization myth. So anyway.
That would resonate with me. So let's plan on that. When that book starts getting ready to come out and ready to launch, you shoot me an email, shoot me a call, and we'll get you back on here.
Sounds good.
All right. Well, hey, keep doing what you're doing. I love what you're doing. I love your hope, your attitude. You're challenging the system and everything else. So just keep doing what you're doing and keep aging well.
Oh, thanks so much, Jeff. I've really enjoyed this.
Oh, you're welcome. Thank you for listening. I hope you enjoyed this episode of the Aging Well podcast. Please like, subscribe or follow, and share this episode with a friend. And be sure to visit the affiliate links in the description below. Thank you for listening, and until next time, keep aging well.